Good evening, friends, and welcome, welcome, welcome. We are so excited to bring you this special live presentation about how to get your medical cannabis card and getting easy access to medical cannabis. And what's special about tonight's presentation is we are so excited because Nantucket now has a patient-operated dispensary. The Green Lady. Hello, ladies. How are you?
Hi, everyone.
Awesome. All right. So I want to get this night started with just some housekeeping. We are streaming this live to the Green Lady Dispensary page, our MedWell Health and Wellness page, and our YouTube channel. And guess what, friends? I can see all your comments and your questions. So make sure along the way to drop a question and we will do our best to answer them as we go. We have our awesome teammate Kayla in the chat here, and she's going to be dropping some great links about what we're talking about, and also an opportunity for you to get some great discounts at the end of tonight. So let's get started. I want to first start with introductions. We have Emily Waxman, the Director of Community Outreach here at MedWell. We have Rob. Hello. We have Rob Durante, the President of MedWell. Hello.
Hi, everyone.
And we have our friends from the Green Lady Dispensary. We have Corbett Campbell, the Retail Manager.
Hello there.
And we have Tina Law, the Medical Sales Agent.
Hello.
Awesome. Great to see everybody tonight. So we are going to get this party started, friends. You know, I think one of the things is there's always lots of questions about how to get your medical cannabis card. And we have a great presentation lined up. And again, feel free to leave your questions. So I'm going to put myself and our Green Lady friends in the back room, and we're going to have Emily and Rob lead this presentation with some great slides here, and we will see you all shortly. So let's get going, Rob. You want to share your screen there, my friend?
Absolutely. Coming right up. Perfect. Thanks, April. So hi, everyone. My name's Rob. Like April said, I'm the president at MedWell. I'm here with Emily tonight to tell you guys a little bit about how you can get your medical marijuana card in Massachusetts. Obviously, specifically with you being on the island and Nantucket, things are a little bit more difficult as far as access is concerned. So thankfully, we have the Green Lady Dispensary here now that can service the patients in Nantucket and give them the same high level of care they were giving to their recreational users now to the medical side of things. So we're so happy that they've been able to open this past month for medical. And we have our telemedicine services where we're able to reach the island, any time of the day, 7 days a week. So we're happy to tell everyone about how to do that and get started with showing you all how easy it is to get a medical marijuana card in Massachusetts. So the first thing that I want to talk about is just an overview of the process. So in Massachusetts, in order to become a medical marijuana patient, you must first see a qualified physician to be certified for the medical use of marijuana. So we have offices, MedWell has offices that are open daily. But more specific to this audience is going to be our telemedicine offering, which is 7 days a week. We have morning and evening appointments available for video consultations, which I'll talk a little bit more about in the next slide. But we make it as easy as we can and as personable as we can so that you're still getting a pretty high level of care, even though you're not able to visit with us in person at one of our offices. After being seen by the physician and being certified, the patient's going to receive a PIN number and an instant access ID as long as they qualify. The good thing about the instant access ID is they can use it that same day to go over to the Green Lady and make a purchase, and they're able to start their medical marijuana treatment that same exact day as long as they've been approved. That's a new, relatively new addition to the program that we have here in Massachusetts, and we can't be more thankful for it because it allows our patients to get started right away instead of having to wait for like a long waiting period for their card to arrive in the mail. But they're going to use this PIN number that they've also been issued with their instant access ID in order to register online with the CCC, the Cannabis Control Commission. And that instant access ID that I was talking about, it's only good for 14 days and it can be used to purchase a limited supply of medication while you're waiting for your registration to be completed. So we'll talk a little bit more about that, everything on the coming slides, but we're going to really dig into what the difference between a registration and a certification is and how you can make sure that you keep both of them active for the whole duration of the time that you're a patient. So once you submit that application to the CCC, the Cannabis Control Commission, they're going to review it and they're going to make a determination as to your eligibility, usually immediately, but sometimes within 5 to 7 business days. So there are some extenuating circumstances that cause the review to take a little bit longer. But if everything goes according to plan and you're able to submit the normal IDs that they ask for, it will be an automatic review that will check with the RMV's records and will cross-reference you with the information you submitted, and it'll issue your temporary ID to you. So after the review, the application will be approved, provided that no issues arise, and that's whether it takes the 5 to 7 business days or instantly. And at this point, you're going to be eligible to print out your temporary ID. So the temporary ID is different from the instant access ID because it lasts longer, it has your picture on it, and it goes the full, it gives you access to the full allotment of medicine that you're allowed to buy every 60 days. Somewhere within the next 30 days after that point in time, you're going to receive a hard copy of your ID in the mail. So you'll get a plain white envelope, nondescript, addressed to you, that will have a folded piece of paper inside of it with your hard copy ID attached to it. It looks just like a driver's license for the most part. The verbiage on it's obviously different, but it has the same watermarks and the same color marks and the same designs to make sure it looks just, the exact same as your driver's license. So again, I think the most important thing for everyone tonight to realize is that we do have telemedicine now. Since the COVID pandemic, we've been able to kind of pivot and change how we offer our services. So we still have our offices open. We have 8 offices in Massachusetts, in Brockton, Brookline, Fairhaven, Lowell, Marlborough, Mashpee, Pittsfield, and Somerville. And the closest being on the Cape, but still a ferry ride away, planning a whole day to get over. We understand it's not really feasible for most people. So we used to come directly to the island. We would set up pop-up clinics with, different places that would have us or that we would, find suitable to be able to provide our services for a day or two and make sure we were able to take care of the people on the island. But after COVID came, that became very difficult with, public gatherings obviously not being a thing and everywhere being closed. So we fast forwarded a little bit. We were able to start offering telemedicine, and we were able to kind of change our services to get people the care that they need from wherever they're able to be, have a high-speed internet connection. So that means,
Sorry to interrupt you,
Yeah, go
Rob.
ahead.
I just wanted to mention too that we really have done, or I should give you all the credit in the world, Rob, because you have really made the telemedicine option very, very easy for folks. So certainly I don't want to scare anybody away. Sometimes I think that we have some folks that get a little bit nervous about getting a link or having to connect. I want to reiterate that we really have done a phenomenal job with our team of making sure that we help our patients at every step of the way to kind of get that process for them and make it as easy and seamless as possible. So I know that it can invoke a little bit of anxiety for some folks out there, but I really want to encourage patients or if you're interested in calling us about it, to really, ask some questions and we'll explain it and really make sure that we get you connected, with the nurse practitioners that you'd be meeting with.
Absolutely. And they do such a good job of making sure that the patients still get what they need out of the appointment, I think. So as much as I would like to take credit for it, I know, which I appreciate, our nurse practitioners and our doctors just go so far above and beyond for our patients. And it translates into the telemedicine appointments, which is really nice because, as Emily knows, our number one concern that day, almost exactly a year ago where we made the transition to telemedicine, we were very concerned with, the stigma that's associated with medical cannabis and the level of care that people expect when they come into us, because it is a difficult decision for people to make. And we understand that it's not for everybody the easiest thing to do to pick up the phone and call and say you'd like an appointment to use a medication that you're previously the whole entirety of your life you've been told is a really bad thing and to stay far away from. So then adding another layer of, at the very least, if you did have those concerns when you get to our office, you see our smiling faces, you see that it's nice and clean and well organized, and they're not a dimly lit back alley somewhere, and that helps with that. But the digital aspect of it, like Emily said, completing paperwork online and transferring documents online, and so everything we have is HIPAA compliant, triple encrypted. Your video connections when you meet with the providers are encrypted. We have a way for you to text message us your ID that's completely encrypted and HIPAA compliant. It'll automatically get uploaded to your chart and then deleted off the servers forever. So we've been able to really use technology to our advantage, and thankfully the technology was available to us. We just had to find it to make sure that patients can get us what they need safely, securely, and in a way that isn't going to infringe on what they're actually coming to us for, which is help with something in their world that is ailing them. And you don't want to further frustrate or further make something worse when a lot of our patients are coming to us with anxiety issues or whatever it may be. You don't want to add to that by making the process difficult. So we put a lot of effort into it. We're very proud of it, and we hope that you're able to try it soon and you can see what we're talking about.
Yeah, and we're here to help you every step of the way.
Absolutely. Yep. Yeah. We have dedicated phone lines open from 8:30 in the morning till 8 p.m. at night, most 6 days a week. Sundays we're still open. And even if you call after hours in the middle of the night, you're still going to get a live human that answers the phone. They're going to take a message and they're going to get it over to us and make sure that we have it first thing in the morning to get right back to you. So we're always available. Also through the live chat on our website. If you ever have any issues or questions, Kayla's on there. Tori and Jack and Tyler are all on there. So they're Medwell employees that work full-time for us. They're not, it's not outsourced to some third-party company. It's really us that you're chatting with. So feel free to go on our website and start a live chat if you're at work and you can't make a phone call, or we're basically always around to help in some one way or another. So when you come in for your actual visit, I get the boring slides, by the way. I have all the wordy boring slides. Emily gets to talk about the fun stuff. But,
You do.
So I try not to bore everyone to death. But your physician visit when you come into Medwell or you have your telemedicine appointment, whichever one happens, is where you're going to meet with the provider and you're going to discuss why you're there, what's going on, and why you'd like to use medical cannabis, why you want that option. So in Massachusetts, we have over 275 qualifying conditions. And we are by far, in a way, one of the most inclusive states in the country when it comes to who can get a medical card and who can't. To put it in perspective, we have some offices in Florida. There's 13 qualifying conditions in that state. So in Massachusetts, most everyone who has some sort of debilitating condition, which Massachusetts has defined as anything that affects your overall quality of life. So most of us, unfortunately have one thing or another that's affecting our overall quality of life. And they've defined, specifically over 275 different qualifying conditions that would qualify you to be a patient. So you come in or you have your video visit, you're going to fill out some paperwork that goes over why you're, what's going on with you, just a snapshot of your current state of health and what you've done up to this point, what kind of surgeries you've had, what kind of medications you take. And then you're going to have a very casual hands-off appointment with a provider where they're going to talk to you about medical cannabis. They're going to explain to you how you can get started. They're going to explain to you how we want you to utilize the knowledge that the people like the green ladies have at the bud tenders and the people that you go and you meet at the dispensary with when you actually pick out the products. We rely very heavily on them to help us educate the patients about the actual products that they offer. And because they're the experts, they really are. They know so much about their products. They formulate them in-house in many situations, or they're wholesaled from other dispensaries that are able to discuss, very specifically the formulations and how they work with them. So there's no one better to talk about the medicine than the people who are, handling it every single day. So we're so thankful to have them, and we're so thankful that they take their job so seriously and that they put the effort and the time into training the employees to be able to help people pick out medications and pick out strains that'll work best for them, because everyone's different. And that's kind of what the doctor and the nurse practitioner will talk to you about during your visit, and how to start low and slow and how to acclimate yourself to cannabis if you've never tried it before. And then when you come back for your renewal appointments, you're going to pretty much steer the ship. You're going to talk to us about what questions you have. Did you have adverse side effects? Is there something that's just not sitting well with you? And you're going to have the time allotted to sort out any questions that you have. The good thing about Medwell is that we're your resource for a full year.
I was just going to say that. Yep.
Oh, okay. So you got us for the full 12 months. You need to come in once a year and see the provider. The state requires that we do see you at least once a year, either via telemedicine or in person. But that's the only time you pay a fee. Every other time, if you need our resources for whatever reason, if you're having trouble registering, or if you just have questions and you need to follow up with the provider and ask them something you forgot to ask during the visit, or if it's 6 months into it and you're still not getting the results that you're looking for, there's no charges for follow-ups. You're able to communicate with us and with the providers freely and openly, and we encourage you to do and as much as you need to, because we want you to have the best experience possible.
Absolutely.
So after you see the provider and you come into Medwell, whether it's telemedicine or in person, you have to register with the state. Any of our patients that are 65 or older, we complete this process for them so that they don't have to do it at all. It's built into the price. It's part of our senior discount. If you're under the age of 65, we just ask that you attempt to complete it first. And then if you don't want to, if you have any issues with it or anything along those lines, we're happy to pick up for a fee and complete the registration for you. So we're going to give you a PIN number. It's your personal identification number that signifies to the Cannabis Control Commission that you saw a provider who's certified to issue medical cannabis recommendations, and that provider deems you to be qualified to use medical cannabis. So at the very same time you get that PIN number, you are going to get your instructions on how to register with the state. It's very easy. You just have to go on their website. You have to identify who you are, give them a copy of your driver's license, and just verify your address, your phone number, things like that. Once you get that registration packet. On page 7 of that registration packet is the most important piece, is the 14-day instant access pass, because that's how you're able to take, right after your visit with the provider, before you do anything registration wise, you're allowed to go right to the dispensary with your photo ID and show that 14-day instant access pass and make your first purchase. So medical patients, which Emily will talk a little bit about, have a purchase limit that they're allowed to purchase every 60 days. It's usually more than most people need. That 14-day instant access pass gets you access to a portion. You're not allowed to go buy the full allotment on that 14-day instant access pass, but you are allowed to go make a limited purchase, get started, so that you're able to start your treatment right away and then complete your registration after that. Like I said, the registration usually happens, the approval of the registration usually happens instantaneously. If you provide an ID that is not a mass ID or a mass driver's license, like if you use a passport or if you use a military ID, there is a manual review that the CCC has to do on the application. They can't automatically approve those applications. So as long as you use your mass ID or your mass driver's license and nothing, comes up during the cross-reference, you'll be approved right away. If you use a passport or a military ID, then you will have to wait for them to manually review it. And like I said, that takes about 5 to 7 days. When they're done, you get an email saying you've been approved. And then at that point, you can log back into that same website. It'll all be changed because now you're going to be an active patient of the program. And you'll have a link that will allow you to print out your temporary ID. So your temporary ID is what gets you access to, it's good for a full 30 days, and it gets you access to the full allotment of medication that you're allowed to purchase as a patient in the state of Massachusetts. So you're no longer limited in any way. That ID is just as good as your hard copy, except for the expiration date. It's only going to expire within 2 months, and your hard copy ID will be good for a full year. So what'll happen after you get that temporary ID printed out, that'll trigger your hard copy to be printed at the Cannabis Control Commission headquarters and then mailed to you. And that usually happens within about 2 weeks or so. So within 2 weeks of completing all this, you'll get a white envelope in the mail. It'll have your ID in there and you'll be good to go. You stick that in your wallet and you don't really have to think about it again until we call you 11 months from now to remind you that it's time to come and renew. And like I said, if you have any questions in between that time, then we encourage you and we ask you to call us and schedule yourself a follow-up appointment so that we can get those questions answered for you.
And what I think that I should mention too, Robbie, that what sets MedWell apart from some of the other physicians out there is that we actually have our own in-house registration group. So if at any point you get to any part of this process and you have questions and you're having difficulty, please call us, because we certainly want to make sure that this is a very seamless process. By us explaining it, it can sound a little bit overwhelming. We promise you that as you're going through it and we help you with it, it's not nearly as much or as complicated that it might sound as we're kind of giving you the step-by-step process. But MedWell really has done a wonderful job in servicing its patients with helping them get through it and accessing that registration department, because the folks that work there are just amazing and are able to really help get you through it, get it done so that you don't have to, stress about it. And we really make it a very seamless process for you.
Yeah. And also, regardless of how you complete your appointment, you're going to have MedWell staff assisting you with everything throughout every step of the process. We have, detailed email instructions for everything that we talked to you about on the phone. So you're hearing it from us verbally. And then we're sending you follow-up emails instantly with everything we just said, reiterated in text form so that you don't have to remember or take notes while you're talking to us. And then we have, like Emily said, we have a registration department to help with any registration issues. And we have an in-house call center that's staffed by MedWell employees that operate the offices and that have worked here for years. And they're 7 days a week, Monday to Monday. We're always there to answer the phones. So it's really nice when someone, you can get a hold of the same person, multiple times if you need to, because you're not going to be bounced around from operator to operator. Someone's going to take control of what's going on with your situation, whether it's you needing assistance with your appointment or if you need assistance with your registration or whatever the case is. Someone's going to be able to pick that up and run with it and then see it through to its completion and then let you know that it's done and that you don't have to worry about it anymore and that we've taken care of it, instead of calling a 1-800 number and never knowing who's going to pick up on the other side of the phone. Mm-hmm. Emily knows all too well. People ask for her by name, so feel free when you call. So again, just to reiterate, it's so important to remember. So you have to have both a certification from a provider, which is what we have at MedWell. That's what we do at MedWell. You come, or you do a telemedicine appointment, you get issued a certification by one of our providers who's been registered with the Cannabis Control Commission to and licensed to issue recommendations for the medical use of marijuana to patients in the state of Massachusetts. Not just any provider can issue you a recommendation. They have to be certified with the CCC in order to do so. And then once you complete that, you have to complete your registration with the state, with the Cannabis Control Commission. It's done online. You can do it by mail. We don't even explain how to do it because I'll pick it up and do it myself before I let somebody mail it in. It takes a very long time, and it's just not the best system to do when they have this online portal to do it on. So you could do the registration once you see Medwell, and that makes you good for a year. You need to renew both of those annually. So once every year you need to see the provider, and once every year you need to renew your card online with the state. Just re-verify that you're still a citizen. I'm sorry, you're still a resident and that you still have valid residency in the state. You do that with a photo ID, primarily a driver's license or a mass ID. If you don't have a driver's license or a mass ID, you can use a passport or a military ID. If you use a passport or a military ID, you do have to provide secondary form of proof of residency in the form of like a vehicle registration or a certified mail from a state agency or I believe they'll take like bank statements, typical, run of the mill utility bill, things like that. Exactly. That was the one I couldn't think of. Thank you, Emily.
No problem.
So if you have any questions, we've listed the Cannabis Control Commission's phone number right there. We encourage you to call us first if you have any questions, just because we don't have as long a hold times. The CCC, they're awesome. They do the best they can, but they have a lot more people calling them, and thusly there's hold times involved. So we encourage you to give us a ring first. We would like to be able to give them the opportunity to answer any question you have before you get on hold with them. And then if we can't, then we'll tell you, sorry, we're unable to help you, and we'll instruct you to call them. So we also included their email address and the website, which outlines all the details about the Massachusetts medical use of marijuana program, all the guidelines, all the regulations, and lists out all the different applicants, dispensaries, things like that. It's a wealth of information. One thing that, before I hand it off to Emily, and she's going to talk to you guys a little bit about a different part of the program, is I wanted to touch on caregivers. And so in the state of Massachusetts, we have a very good caregiver program where patients who, for whatever reason, it could be because you're immobile or you are unable to, for whatever, it doesn't really matter what the reason is, but patients, for whatever reason, are allowed to designate a caregiver if they would like to. And what a caregiver is allowed to do, currently as it stands today, is go and purchase cannabis on behalf of that patient or order delivery on behalf of that patient for at a medical dispensary. So patient can go onto this CCC website once they've been approved and once they have their medical card. So in this example, if I were the patient and Emily were my caregiver, as soon as I've been approved as a patient, I can log back into that Cannabis Control Commission website. I can click a button and I can input some information about Emily, and I can notify the Cannabis Control Commission that I'd like to designate Emily as my caregiver. It'll trigger an email to get sent to Emily. Emily will have a similar registration process that she has to complete, very similar to mine as a patient that I had to complete, where she'll have to upload a copy of her ID, and she'll have to tell them who she is and where she lives and what her contact information is. Emily's application will be reviewed by the CCC, and then Emily will be issued the same ID card that I have, only it'll have her picture on it, it'll have her name, and it'll say caregiver instead of patient. However, her card will be linked directly to mine. So when she goes to a dispensary, even though Emily doesn't have any reason to have a medical card, she doesn't use cannabis, and for whatever the reason, I need Emily to be able to purchase my cannabis for me. She's able to do so. Her allotment is linked to my allotment. Everything is linked to me, and that way she's legally able to purchase and transport cannabis for me and to me, and get me the medicine that I need if I'm unable to do so for myself. So it might not seem like a lot if it's not something you would utilize, but for our patients that are unable to get out of the house very easily, or maybe they live in assisted living facilities, or maybe they live in far away from a dispensary, or just whatever the reason is, there's a million different reasons. The ability to add a caregiver who can help them obtain their medicine is something that's really allowed us to touch a lot of people's lives and help a lot of people that really needed access to medication. And
especially during COVID.
Yeah, especially with that. Couldn't say it better myself, because some people now literally can't leave their homes, when before they could. So they're able to register that caregiver, have somebody else make their purchases for them or organize their deliveries for them, and not have any gray area or looming, legal issues for that person in order for helping them out. So we included both the registration guides for both patients and for caregivers, as well as clickable links in the presentation, which Kayla will drop in at some point, or we'll put in the comments. And that way, anyone who needs any assistants registering their caregivers, they can get the information right there. So at this point, I'm going to hand the presentation over to Emily. She's going to talk to you guys about the difference between medical and recreational in this state, because there is both programs. You don't need a medical marijuana card to purchase cannabis in this state. If you're over the age of 21, you are allowed to go to recreational dispensaries and purchase recreationally, but there's a lot of, with most people qualifying in the state, there's a lot of benefits that patients get as opposed to recreational users. So Emily's going to talk a little bit about that on this next slide here.
Thank you very much, Rob. So yes, so we get this question quite a bit. Why would I, come and spend the money to get my medical card when I can just go and purchase and, just get what I'm looking for? And, I think for those folks that are just looking to once in a while make a purchase, of course, then a medical card would probably not be very beneficial, and maybe someone would not get their money out of it. But for those folks that are going on a regular basis or are using medicine or are using cannabis to medicate themselves, then you absolutely need to get your medical card. And this slide is just it just basically says it all. I mean, the other slides are also important factors, but the sales tax here in Massachusetts, the 20% sales tax is just, if you're going on a regular basis, the card is just going to pay for itself instantaneously. So I'm excited for the Green Lady to be talking about their benefits and discounts when you become a patient. But there just is every dispensary out there are these amazing discounts that are going to help save you money. And everybody nowadays works so hard for their money, and you should be keeping some of that in your pocket if you can. So
patients pay 0%, right?
Patients are paying 0%. So the sales tax, thank you, Robbie, is 20% plus for the adult use side, and for medical patients, it is 0. So it absolutely makes sense that if you're going on a regular basis and you're medicating yourself for whatever your reasoning, you really need to look into getting your medical card, because I just think that is just going to end up saving so much money in the long run, with the benefits of the discounts and the promotions. And on the adult use side, they are not allowed to run those promotions or discounts. So it just makes sense to look into getting the medical card and letting us help you with that. And also, a lot of times too, you'll find that the adult use side has, a lot of folks waiting in line. So if you're in a rush and you got to stick yourself in that line, it can take a while, and that can be a bummer. So for the medical side, you can go. They have designated registers and lines. They usually are pretty quick, so that you're not finding yourself having to wait in these long lines, and just makes things so much easier for you. Especially if you find that you're going on a day where it's a little bit more crowded, knowing that you can go to a line where a lot of times too, for the medical side, many dispensaries have an area where it's a little more private. You'll find that you'll get a little bit more, one-on-one. It's really a much nicer, experience when you're going to go purchase whatever you're looking to go pick up for yourself. So certainly one of the benefits of having the medical card.
Especially now with people, especially like our immunocompromised patients, or that just physically can't be in a crowd. I think a lot of the dispensaries do a really good job on both sides of the fence, but just having those separate lines where you're not waiting with everybody else. If you're, COVID, we can't, the obvious thing that everyone talks about. Absolutely.
A home delivery too is another really phenomenal benefit of having the card too. So, the dispensaries make it really nice and easy. They have these programs where you either call up, or you can even go online and go through whatever their process is as far as just getting it set up for yourself. And again, this has been an absolute savior for folks that are, dealing with COVID, have to really be careful, cannot put themselves out in a crowd. So knowing that you can get this delivery, again, like I said, the dispensaries kind of have really got this down to a science as far as, the whole process. They make it very, very seamless. And it's definitely worth taking advantage of, especially when you're a patient of the program. I guess one thing I should say too is, we like to refer to having your medical card as really almost like being in a VIP program. So, you get access to being able to just do all these things that folks on the adult use side just can't. One of my favorite things too is when I pull up to a dispensary and I get to park like right in the front. They've got signs that say for medical patients only. And there's just nothing better knowing that I can drive by, the lines or the folks that have to be waiting outside or have to park far away, knowing I can just pull right up, get out of my car, go right in, walk right up to the front of the register. It really makes the whole experience just so much nicer, and just all the anxiety that one would have of even entering the dispensary immediately just goes away. So it's just really, like I said, it's like having this, important card that you get to pull out and take advantage of all these amazing discounts. And then again, this product access that Rob has up on the screen right now. So when you are certified, you are able to purchase 10 ounces every 60 days on a rolling schedule. So as you make these purchases, it falls off of your allotment. And so then as the 60-day schedule goes along, then it's put back onto your allotment. So maybe Rob can just explain it a little bit better, because I don't want to get into where I'm confusing anybody, which I tend to do when I try to explain this. So maybe Rob, you can tell people kind of a little bit better how that works.
Yeah, basically and it does get kind of confusing, but in Massachusetts, a patient is allowed to purchase 10 ounces of dried usable flower every 60 days. So dry usable flower refers to cannabis as most people know it, the buds of the plant that you would break up and then smoke either in a pipe or a roll or vaporize. That's what they mean when they say 10 ounces. So as many of you know, there's a million other products you can get when you go to a dispensary that, like the Green Ladies are going to tell you all about, but you can get edibles that you can eat and topicals that you can apply to your skin. They have tinctures, like drops you can put under your tongue. They have capsules. They have all sorts of things that help you medicate discreetly or in different ways, or target different areas of your body or different ailments that you might be having. And so if you were to buy like a chocolate chip cookie that maybe is infused with only 20 milligrams of THC, they're not going to weigh that chocolate chip cookie and then take that, the weight of the flour and the butter and the chocolate chips off of your 10 ounces. There's an equation that they use to convert that 20 milligrams of usable, the actual medicine that's in the chocolate chip cookie, and use that to deduct from your total. So that's the detailed version. The reason it's important in practicality is because recreational users are only allowed to purchase 1 ounce at a time. And what that ends up resulting is needing to take multiple trips to the dispensary in order to get a month's supply of medicine. So if you're anything like me, I not that I don't like going, but we all have so many things going on, and nowadays, and life gets so busy with schedules and kids and practices and all this stuff. Having to go to a dispensary, 2 or 3 times a week, 2 or 3 times a month might not be feasible for everybody. So as much as they might like to do it, they might not have the time to do it. So having that 10 ounce at a time allotment allows you to go in and literally purchase 10 times at any given moment what a recreational user would be able to buy. And the reason we say it's on a rolling schedule is because it's literally, if you make a purchase and exactly 60 days later, whatever weight was deducted from your 10 ounces gets added back. So you start with 10 ounces. That's where you begin your journey. And every time you make a purchase, it gets deducted, and a timer starts on that weight that was deducted. And it's a 60-day timer. And when that timer expires, that weight goes right back onto your limit and you're able to purchase it again. So the easiest way to explain it, if you on day one, if you were to buy 10 ounces, then you would be at your allotment and you would have to wait 60 days before being able to make another purchase. If you were to buy 5 ounces and then wait 30 days, obviously you'd still have 5 ounces on your allotment. So it's confusing. The dispensaries do a great job of explaining it and letting you know where you stand against your limit. Patients very rarely reach that limit. It happens. It definitely happens. We see a lot of patients, and sometimes people get there, but it's not very common. So it's just the real benefit is being able to purchase more than like a 7-day supply at once, so that you can get the volume discounts, because it's cheaper the more you buy, and you get more loyalty points, and you can capitalize on sales that dispensaries have. If there's a product that you like that happens to be on sale, you're able to stock up on it and get multiples of them instead of being limited to just buying one or two, or whatever you have in your left in your daily limit.
So, and then the last thing too is the consult services. So like Rob had mentioned earlier, we certainly want to be that physician for you throughout the entire 12 months that your certification is active with Medwell. So if at any time you want to give us a call and, say that you'd like to talk to your nurse practitioner or your physician, whoever you met with, we will absolutely put you in touch with them so that you can let them know what's been going on, let them know about how things are working out for you. If there's items that you liked that, maybe to find out if they think it's beneficial to go up in a dose, or maybe you're not having some luck and maybe you're feeling a little discouraged and you want to just, talk to them and see if they have some other recommendations for you. That's what we're here for. That's again, what sets Medwell apart from some of the other folks out there is, we want to be that physician for you through that entire 12-month certification so that you will come back to us so that we can get you recertified for another year. So absolutely make sure that, if you are feeling as if you need to reach out to us, we are here. We will absolutely put you in touch with whoever you had seen. Maybe it might not be able to be done that particular minute, but we'll certainly get in touch with them, give them the information so that the nurse practitioner or doctor can follow up with you a little bit later in the day and, help get you on the journey to feeling good. So I think we're at the end there, Robbie. I think
we're ready to hand it over
to our
the
friends at the Green Lady.
Absolutely. So we just want to let you know that we're available when you're ready. You can call us. We're going to be dropping a link, and you're going to be receiving an email after this presentation with a discount code that we're going to allow you to stack on top of our current promotional pricing. So right now we're offering $25 off for everybody that signs up as a new patient. We're going to be offering an additional discount for people that joined us on this stream tonight that we're going to allow you to stack on top of the $25. So we're offering some pretty good savings for new patients. We have, we're going to have you guys give us a call to book those appointments in order to get the extra discount. We're going to give you a special code that you're going to have to mention over the phone in order to receive that discount. But we encourage everyone to stop by our website. Please check us out. Look at our blog posts. We have a dispensary map that you can look at all the dispensaries in the state, so that when you guys are away from the island and you're maybe you are not full-time residents, or when you're off the island, you can check out what else is available to you. But we encourage you to stop by and check it out. And at this point, we're going to turn it over to our friends at the Green Lady. We have Corbett and Tia, and I think April is going to bring them in. Hi, guys. How are you?
Hello. Hi, everyone.
Awesome.
I'm Corbett. This is Tina. We've been working together for quite a while, and we're really excited that we're able to serve medical customers as of last week. And we're just kind of gonna go over how a lot of the things that Rob and Emily just talked about incorporate at the Green Lady, and how it differs from your previous visits as a recreational customer. So I'm going to let Tina take it away.
All right. First of all, I'd like to say thank you so much to Medwell, because it's a great service to provide to the island, and it does make it more accessible for islanders living here that, with getting a boat ticket and possibly having to rent a car and all that, it saves them quite a bit of money. And everyone that has come in has said how easy it was to go through this process with Medwell, and they were just so happy about it, because I think there is anxiety, and then all of a sudden, they go through it and they're like, oh my God, that was not as hard as we thought it was going to be. And I really think that, they're just so happy to have the medicinal part of the Green Lady now. And we thank you so much for your help there. Now, one thing that we do have, there are discounts and loyalty points with the program now. And for anybody with a medical card, it's just makes so much sense to do this. So for instance, with our loyalty points, for every dollar you spend, you get basically a 5 cent or a 5% loyalty that accumulates, and you can use at a later date. So that really works well for some people, because they're spending quite a bit of money when they're having to deal with medical issues. And we also have daily deals. And so with our daily deals, for instance, I'll go over some that we do have. And for anybody who wants to come in, we are talking about printing this out nicely so that you could take it with you and have an idea, but it also be on our website, and they can find it there. We have Munchie Mondays, when you can buy 2 edibles and get 1 at 50% off. And then Tincture Tuesdays, where all the tinctures are 15% off. We have Waxy Wednesdays with the concentrates, $10 off. Topical Thursdays, where the topicals are 15% off. Flower Fridays, where you can get an eighth for $45, any eighth that you like, high tier or lower. We have Silly Saturdays, where you will buy 2 PAX pods and get the third at 50% off. And then Stash Sundays, buy 3 pre-rolls and get the last or fourth one free. Also, with that, we also have some discounts for certain people. Like we have a 15% veterans discount, 10% for first responders. We also have a 10% for senior citizens. And one of the really nice things is the first time you actually come in and make a transaction with us in medical, you get 20% off your entire purchase. And people just love that. And they're just very thankful. And so are we, that we can provide this service to the island. And a lot of people said, you're really helping me out. The compliments have been so great to get, and they were both to us for having the program, but also to Medwell. So I just want to pass that on to you, because it was really, really nice to hear that. And I know that we don't pick up the phone and let you know people are loving this, but they really are. And thank you for making it so easy. Now, I know Corbet wanted to go over a couple other things that we offer as well, and yes. I'm going to let her do that.
And to follow up what Tina was talking about, and also what Emily was talking about with product access, we at the moment are currently developing some high-dose edibles and tinctures for medical customers only. So I know that the first one, I can't say exactly when that's going to be rolled out, but the first one is going to be a high-dose fruit chew, where you'll be able to get more than 5 milligrams in a single serving. So that's very exciting as well. And then some other things that also, were touched upon, but for the Green Lady, we do accept curbside pickup for both recreational and medical. So if you, don't want to come in due to COVID or anything like that, you are able to now also place a curbside order for medical sales. You are also able to come into the dispensary as well, and we do walk-ins for medical as well. We have a special medical point of sale station that's kind of off to the side, and it has a divider, so you definitely get your privacy. Someone today was like, oh, I didn't even know there was anyone over there. So you definitely, will get your private time to ask any questions that you want to know about our products. There's in the special area for medical patients, there's a separate menu where you're going to be able to see different products that may not be available to recreational customers, including those high dose infused products such as edibles or tinctures. And the one thing as well that I will say about the specific situation that we're on Nantucket versus, dispensaries that are able to operate on the mainland. Currently we are not allowed to do home deliveries due to local regulations put forth by the town of Nantucket. So that could change theoretically, but as of right now, we're not doing home deliveries. And if that was something that sounded interesting to you, I would encourage you to get a registered caregiver, just because they'll be able to come and pick up your medication for you. And, you know, the Green Lady won't be able to get it to you, but you'll have someone dedicated who will be able to. So I think that is our the majority of you know, what we do with the Green Lady as far as medical goes.
It's awesome. And I mean, I'm a patient myself, so I can tell you guys that my favorite part about being a patient is the loyalty points. There's nothing better than getting there and not having any idea that you have a discount waiting for you, and then you get that little bit of news. And I wasn't aware about the home delivery, so I'm sorry about that. That's my fault. But that's all the more reason to be, like you guys said, register a caregiver. And that's so awesome that you have curbside pickup for both your rec users and medical. That makes it so much easier for people, because even if you are just trying to avoid the crowds, you can stay in the car and you guys will bring it right out, it sounds like, right?
Yes, we will. And we do have the dedicated lines, so we're gonna always, you know, go serve our medical customers first.
Awesome. Corbin and Tina, I just wanted to ask you a quick question. So the discounts are awesome and the products. Can you just tell a little bit about the patient experience? So like when they come to the dispensary for the first time, so they have their telemed appointment with Medwell and now they're coming to you guys. What should they expect when they come through the door or call you guys, of how you help them to find the dosage, you know, the low and slow philosophy, but really finding the right products that they need?
I'll start and I'll let you talk about finding the right products maybe.
Okay.
So as far as the process of coming inside of the coming into the dispensary, you're going to want to bring, you know, you're still going to need to have your identification, government issued identification, in addition to your medical card. So you're actually going to need 2 different forms of ID now, one of which being your medical card. You're going to need a mask to come inside as well as curbside pickup. We need everyone to wear a mask. And we, if you are, I believe, and we haven't had this come up yet, we've only been open for a week, but if you are under the age of 18, you do have to bring your caregiver. You can't enter on your own. And if you are over the age of 18, you need to have both IDs. But if you are under 18, you don't need to have a driver's license or anything like that. But you do need to have a caregiver and your medical card. Both of you need to have your medical cards. So basically, when you show up to the front window, you're going to want to hand over both of those IDs. We're going to check you in as a medical patient, and you're going to go into the registration room. We're just going to verify all of your identification. You're going to make a hard right, and the medical counter is going to be right there. Of course, you're welcome to look at, you know, the rest of the store, but as far as medical goes, it's going to be over to the right. Behind the point of sale, there's going to be a menu for you to check out that has, it's not as big of a menu as the rec one, but it has just as many products, and actually some products that the rec menu doesn't have. And then you're going to be able to talk to a bud tender who's going to be able to help out picking out a product, which is where I'm going to let Tina take over.
Right. And with picking out a product, a lot of times, you know, and I've found this in rec as well before we went medical, people are willing to share a lot of information about themselves and what they're looking for. And of course, for us, I mean, we've learned a lot from our customers themselves, what has worked, what products of ours have worked for certain things. And so we can relay that information, always letting them know that we are not a physician, and that, you know, they actually should take advantage of the services you provide if they have more questions as far as a physician related question. But basically through just reading and then and dealing with our customers, it's been really great as far as trying to find a product that works for whatever they're describing, and just letting them know, like you had said before, to go low and slow, see how it works. We do have some different areas. Of course, they can, if they don't want to smoke, or they may not do alcohol. So there's a lot of area to play around and offer them different products. And so basically just to have a good conversation with them and see where they'd like to go. And basically, I feel like with cannabis, one of the things is you really have to be proactive in your own healthcare. You have to take the time to try the product, see how it works for you, and maybe if it doesn't, maybe you need something stronger or maybe something different, and really play a role in your own health. And I feel like people are finding that they like that. They actually like to be involved, and it's
Empowering.
right. And it's not one size fits all. Everybody is different. Every product we have will affect people differently, and it's just fascinating. And it's a great feeling when they come in and you can help them out. And we've had so many people already just this first week thank us for becoming medical as well, and finding products that will help them with whether it's arthritis or back pain or different things like that. It's just really rewarding in that respect, and also for them as well to be afforded the opportunity to even have this on Nantucket. So I definitely encourage anybody to come in and have a discussion with us. We'll help the best we can. And then basically they also have to do their part in seeing what works for them, and just go from there. But we have a good array of products, and they're getting better all the time. We have a lot of things coming up in the near future. I think is going to be really exciting, and also help our patients here as well. So looking forward to that. And it's been a very nice positive feedback and a really good positive experience overall, I think, for both the customer and for everybody working there. That's like today, just two of us were talking, and after one customer came in, a patient, and everything he said, both of us just looked at each other and we're like, that's why we're here. And it's
a nice feeling.
Great. And it filled up the cup, and it was just so nice. And so we really like helping people. And so I definitely encourage anybody watching to get a hold of you all at Medwell, and then come on in and see us. And
Tina and Corbet, I haven't had a chance to come visit you guys over there yet, but do you have a little private area too if a patient wanted to come and sit privately and discuss, starting off with specific items, or, just wanted to talk to you in private about kind of what their symptoms are, and didn't want to discuss it kind of in the front of the line? Is there a little consult area?
Go ahead. Yes. So once you are inside of the sales floor, we have a divider that is, it pretty much cuts off the whole person. You can't see anyone behind the divider, and it's definitely very private in that area. It's off to the side. You might not even notice it if you weren't looking for it or weren't directed to it.
That's great. I think that's important for folks that are especially new to the program, that maybe just want to come in and know that they have that privacy to be able to discuss kind of what's happening with their health, and know that they can have that private conversation. So thank you again for
that
mentioning
anecdotal evidence that you guys collect day in and day out from the patients about, like, my elbow hurts and this is what I do because my elbow hurts. Like right. You were saying, Tina, there's no shortage of information sharing usually in these situations. So it's when a patient comes in and they say, hey, I've never tried this before, but this is what hurts, or this is what, you guys aren't doctors, but the information you hold as like being the gatekeepers to the medication is so valuable. It's like the doctors, wish they could sit there all day and hear that interaction, because unfortunately we don't have like the extensive stuff. There's some information out there obviously, but we don't have the extensive medical journals that you do about medications that in the clinical trials and things like that they can fall back on. So being able to have you guys to just say that, I'm not a doctor, but Joe, who is a landscaper and his hands kill him, come in here and he swears by this cream. He says he wouldn't be able to work without it. That is going to carry its weight and go, and you can't say enough things about how impactful that'll be to somebody whose hands hurt, because all they know is hands are killing them. And if it worked for Joe, maybe it'll work for them.
Well, one thing that we've done even before we were medical is we have a book that we keep information in. We don't write the customer's name. We
Right.
just write the
Anonymous. And
neuropathy or arthritis. We'll write it down, and because they'll give us their feedback on a product, and we'll write this worked for this. The combination of the body balm and the CBD 1-to-1 with THC candy bar worked for arthritis for this woman.
Right.
So it's really interesting, and I think it is a really good way to stay on top of it, and it gives you an overall feel for different ailments, and so you can make kind of an educated or you can at least offer them a product to try, and maybe that will have hopefully the same effect as the person who reported those findings themselves.
Awesome.
Great.
Well, we're really excited to be working with you on the island. And friends, thank you so much for watching us tonight. If you are catching the replay, please do leave a comment afterwards where we will absolutely get back to you. I know the Green Lady, they monitor their Facebook page as well as Medwell. And don't forget, in the chat area, there is a link for you to receive a discount. So please go there, sign up, and there is an email going out later today that's a timed offer, and we'd love to help you out. And I know one of the biggest things, also a question that's come up, and we're kind of running out of time, but Kayla dropped a link about kind of the license to carry in cannabis. That's a common question. So not only is it in the chat, but it's also the video is included in our replay email with our discount. So be sure to sign up for that. And we hope that we answered all your questions on how to get your medical cannabis card and where to get the best product on the island, right, ladies?
Absolutely.
Yes.
All right. Well, thank you so much, everybody, for your time. Thanks, Kayla, for helping us out in the chat. And don't
Thanks,
forget
Kayla.
to call us and schedule your in-home telemed appointment, or you're welcome to come to one of our offices. We look forward to seeing you all soon. Have a great night.
Bye, everyone.
Thanks, guys.
Yeah.
Bye.